Good morning. All right, we got a couple participants joining. Gonna wait maybe 30 seconds or two or so to make sure everyone joins, and then we'll get started. All right, I see some more people joining. All right, I'm going to begin real quick. Thank you so much, everyone, for joining us today. We're so excited that you could make it. I know how busy everyone's schedules can be. Very blessed that you could be here. For those of you that don't know me, my name is Will Mead. I'm on the Visiting Angels side, and with us today, we have Kathy, who's with Continuum, who knows all things guide. But you know, what I want to start off real high level, what today's focus is really about, it's that family caregiver. And when I say family caregiver, that's what I mean by that is that's the person that has the sole responsibility of taking care of that loved one in his or her life. What my experience with this program and at Visiting Angel has been is that unfortunately there are too many families out there that these family caregivers that suffer this burden. They feel alone many times, and they don't know where to turn. And you hear the term a lot, it takes a village. It really does. So what our goal today really is let you know, whether you're the family caregiver, whether you know a family caregiver, whether you're, in a community, facility, hospital, let you know that you're not alone. And really what our services and this guide program allows these family caregivers to go back to being family members, right? And that's kind of what we're about, bringing that forward today. So today what I'm going to do is going to provide a brief overview of Visiting Angels, and then dive into the Medicare guide program and talk about its unique approach to dementia care. And so I'm going to have some slides, and if anyone has any questions, I see people, please put those in the comment section. If there's something that people agree with or think is exciting, use the emoji to kind of keep the excitement. But with that, what I'm going to do is I'm going to start sharing my screen. And Kathy, you can see my screen?
I can.
Okay. So today what we're going to talk about, what I'm going to do is introductions. I'm going to talk about Visiting Angels and our caregivers and services, our community engagement. Visiting Angels, we are a home care agency, but our community engagement is something that really makes us unique. One of those being, the guide program. We look to be a resource for our clients and the community. So really high level in terms of the leadership here at Visiting Angels, our CEO is Joan, and I highlight her because she started off as a CNA, and I highlight that because the family caregiver, the client, it's at the center of everything we do. A little bit about myself. I'm Will Mead. I'm the business development manager, and I came from a medical device background before this. But my passion, my why is really I'm a volunteer. I'm a hospice volunteer, and I highlight that because it's so important to be connected to the client, that the end user. And I think that's something that makes us unique. And then on my team, I have Lamar, who kind of specializes in the assisted living space, and then Jen Howard, who's has experience in home care. So real high level, there's kind of a lot in the slide, but just so you know about our Visiting Angels, we've been in the Montgomery County community since 2002. So we've been doing what we do for over 23 years. Our caregivers, they go with they have extensive criminal background checks. So at the end of the day, we provide care, but you want those caregivers to know, they're going into clients' homes. You want to know that, they're reputable, but we go the extra step with our criminal background checks, and what that leads is to quality care. We've won numerous awards. Just this year, we've been the employer of choice, provider of choice, leader in experience. And so we have the awards to back up our quality of care. In terms of capacity, we have over 400 caregivers and nurses. And then I highlight this because we'll get into the guide program, but in terms of, like the respite care and the quality of care, our caregivers would be providing that. Our nurses would be, doing the qualification process. So I highlight that. In terms of flexibility, we could work 24/7 or hourly. So we have flexibility there. We're part of we work with veterans, long-term care insurance, ARC Respite, the Medicaid waiver program, and our service areas, Montgomery County, Washington, D.C., Anne Arundel, and Prince George's counties, just so you know kind of our footprint. In terms of our scope of services, I mentioned, we could do, 4 hours a day up to 24/7 live-in, but I highlight our scope of services because these scope of services would be in terms of the respite care side of this guide program. These are what, if someone qualified, these are the services he or she would qualify for. It's bathing, dressing, assisted walking, doctor's appointments, errand shopping, light housekeeping, meal prep, companionship. That's the depth and breadth of our, non-medical services. And then before I get to the next slide, I don't know, Dexter, are there any comments that have come up so far before I get a little bit further? Oh, I see a hand. Oh, let's see. Okay, I don't see any questions. All right. So the last thing that kind of makes us unique at Visiting Angels is we're heavily involved in the community. We just did the DC Alzheimer's Walk 2 weekends ago, raising funds for them. The majority of our clients are 65 or older, and unfortunately, many of them have a form of dementia. So that's why we're involved with Alzheimer's and Parkinson's. We're in Montgomery County involved with some networking groups. And then with the Wounded Warrior Project, we provide care to wounded warriors. In that program, what's unique is we have staff that are life skills coaches, and that's more focused with getting these warriors integrated more within the community. So our caregivers, in addition to that scope of services and care, are somewhat unique with their training. So now let's get into the good stuff, the guide program. So, just some really important dementia, Alzheimer's disease facts. Alzheimer's, unfortunately, it's the 5th leading cause of death for people 65 or older. So it's unfortunately a very prevalent disease. And in terms of those family caregivers, people supporting these people, 74% of them are concerned about their own health. And then of that population, 7% of those people, they have difficulty finding resources and are stressed. And that's really the goal I mentioned today of today's program is, like letting there can be a breath of fresh air. And that's where Continuum and ourselves, we kind of come into the equation with kind of guiding you through this process. So with this slide, this is kind of Guide 101. So like what is Guide? It's a federally run program through CMS, and like all things government, it's an acronym GUIDE. It stands for Guiding an Improved Dementia Experience. One thing that's nice that because this is a federally funded program, it's been around for about 1 year and 4 months, but it's funded all the way out to 2032. So there's some stability funding for a federal program. Who is eligible? Who's this designed for? It's really for caregivers or individuals that have dementia that they have Medicare A and B. and they're diagnosed with dementia at any stage, whether it be mild, advanced, whether it's documented and you suspect they have dementia, or it's documented if someone has Medicare A and B and an unpaid caregiver, that's a spouse, family member, friend, that individual, that family may qualify for this program. In terms of, why Medicare A and B and why Part B is critical, Medicare Part A, that covers the hospital and inpatient care, and Medicare Part B, that covers the outpatient services. And I thought it'd be important to kind of just break down like why Medicare A and B is important. One important aspect about who qualifies for this program is if an individual has Medicare Advantage, it's not covered, and that's because with CMS they view it as Medicare Part C. They view that as private insurance. So if someone has Medicare Advantage and this program sounds appealing, they unfortunately would not qualify. And then a last thing that kind of comes up a lot is Medicaid eligibility. Individuals can have Medicaid and Medicare and qualify for this, but in those scenarios, Medicare A and B or straight Medicare has to be the primary insurance. And then if there's any questions, I have the 800 Medicare numbers with qualification. But with this, I want to pause real quick to see if there's any questions coming in through chat. Any questions? Okay. Okay, I see a question just popped up. Is income a factor at any point? And no, what was that, Kathy? No, right?
No, it is not. As long as you have the traditional Medicare, you qualify no matter what your income level is.
Thank you. Yeah, and with it, yep, and with this program, yeah, it's really like if you have straight Medicare, that's really, and not Medicare Advantage, yeah, income's not a factor. So, who's the ideal candidate for a program like this? This is where I try to create like, real life scenarios with this program. So, if there's a person living with dementia, or you suspect they have dementia, they may qualify. One is they have to have, an unpaid caregiver, spouse, child, friend. One important caveat is, let's say you are that unpaid caregiver, you are that family caregiver, you do not have to live with that patient. And I think that's something really forward thinking with this program, because I think that's very similar. For example, my parents live in New York. Let's say I'm taking care of my parents. If they have straight Medicare, which they do, if they had dementia, they may qualify for that. So that's a real life example. And in terms of, the care setting, whether this person has dementia, whether they're in a private home, whether they're in assisted living, whether they're independent living, they can qualify for this. If they're in a skilled nursing facility or hospice, they would not qualify. So it's really geared to people really in that private residence setting. Now I see a question. Does it matter if you have long-term care insurance?
No, it does not matter if you have long-term care insurance. The one thing is you can't double dip. Like, so you might use long-term care insurance on one day if they're getting respite services too through Guide. So you can use your long-term care on one day and then you can use your respite services on a different day until those respite service funds are used up. But you can have long-term care insurance with the Medicare covered Guide services.
Thank you, Kathy, and thank you, Rebecca, for answering that question. So in terms of like an example, I'm going to give two examples of like who would be, an ideal patient or an ideal person for this type of program. So there's Mary, 78, moderate Alzheimer's, lives at home with her daughter. Her daughter's, trying to keep up with the specialist, and she's burned out with the paperwork, decision making, safety concern. With this guide program, Mary would get, a care navigator, would get the respite care, and also some telemedicine. So that's one type of example. In my experience, I qualified some individuals for this program. Personally, one person that stands out was an individual. He was a former police officer. He had been taking care of his mother for over 10 years, actually had to retire early because he was that caregiver. And then I qualified him through these steps. He got qualified, and excuse me. He said, "This is great. What does it really mean?" I said, "What this means is, let's say it's a 3-day weekend. You can go on a 3-day weekend and come back knowing your mother's being taken care of." And then the tears came down. He's like, "You mean like if I wanted to go to like the movies or something, I can, use this program and go out and then come back and not have to worry?" I'm like, "Yeah." And that's the power of this program. It gives you that little breadth, and that really made this program, instead of just a program in theory, and made it more real and brought it home. So along those lines, who would be a bad candidate, who would not qualify for this? So as I mentioned before, someone has Medicare Advantage or PACE, they would not qualify. If someone has Medicare Part A but not Part B, they would not qualify. If someone's in that, nursing home or hospice, they wouldn't qualify. Or if someone was not in need of a caregiver, they wouldn't qualify.
Can I
So, Kathy,
interject
yes.
real quick? Yes. So they will not qualify for respite if they do not have a caregiver, because the respite part is to provide respite for the caregiver. If you know someone who has dementia and does not have a caregiver, they will qualify for the telehealth portion, the 24/7 support, and the care navigation. And then it's our care navigators' um, job and duty to try to find an unpaid caregiver to identify for that person so that they can qualify for the respite and get the help that they need.
Yes, thank you, Kathy, for that clarification. And that kind of ties into, like, okay, let's say you do qualify for this program. What is the benefit of this program? And I brought this slide up because it kind of dovetails off what Kathy was saying. So, if you qualify, you get a care navigator, and what that entails is, that would be actually like Kathy, her team. They would call once a month, check in, and the care navigator, the way I think in it, in terms of like simple terms, like they're the quarterback. So you start with them, and that's the lifeline. They get you pointed to where you need. And then the second part's the respite care. That's the actual, care of the person with dementia in their home. With this program, you qualify for it. You would get up to 64 hours of care per year. So what that breaks into is you would get 16 4-hour visits in a year. Think of it like a bank. You get 16 of these 4-hour visits you can use for an entire year as you see fit. One thing I want to highlight is that July 1st every year, this program resets. So let's say you do qualify for this program this year, because it resets every year, you would get the 64 hours of care, respite care, every year for the up to 2032. So that's 6.5 years from now. So that's where that stable funding, that federal funding, really comes into effect and is really nice. So it's annual, but it renews every year up to 2032. And then the last aspect of this is the medical oversight. So that's the telehealth side of it, where you get 24/7 access to, over 125 different specialty providers. So I'll pause for a moment. I don't see many questions in the chat, but I don't know if anyone wants to put any questions or anything come up. Let's see. All right, I'm not seen any questions yet. So um, the next slide, I'm going to get into how visiting angels and Continuum kind of work together to do the qualification process. But I don't know, Kathy, do you want to add anything to kind of the Care Navigator side or any of these aspects of the guide
Yeah,
program?
the only thing I would say is that not every Medicare guide provider provides the medical oversight. It is our providers team that decided to do that and offer that through our providership, which Visiting Angels is a part of. So everybody through all the guide providers does have 24/7 access to a support line, but we also add that medical oversight to it as well. Um, and then with the care navigators, yes, we do check-ins on a monthly basis, providing training support, helping coordinate medical care, like talking with physicians to make sure that they know what another physician is doing. We do medication reconciliation. And then we also then offer them, if they need to talk to us more than once a month, they can also call us or reach out to us on an ongoing basis. And with the respite care, I will just tell
Mhm.
you that it does go up each year based on living cost of living. So that's another nice thing.
Yep, and thank you, Kathy. And we actually have a question that came up. It says, "How available is the program? I have a patient in rural areas of the state. Um, is location a hindrance?" So I guess there's two factors of that. So in terms of like the respite care that our visiting angels like our geography, if you will, would be like Montgomery County, Washington D.C., Anne Arundel, Prince George's County. That we could kind of fit that footprint for us specifically. And then what's great with Kathy, like this is a national program. That's where kind of Kathy comes in. Um, and with Continuum, they're on the national level. And I'm not sure Bernadette asked this question. I don't know if you're in Maryland or what state you are, but Kathy, after this, like what she could do is if you're in oh, you're in Ohio. Okay. So Kathy, I'm sure you work with some
Yeah,
individuals in Ohio. She could connect you
absolutely.
to the people that would be would be able to provide an answer with in that scenario. The big thing is just getting the zip code. Once we get the zip code, then Kathy could kind of, navigate and align you correctly, Bernadette. And Kathy, I don't know, do you want to add anything to that?
Yeah, absolutely. What we request is that you try to, yes, send a patient our way. If we do not have someone in that area, it's our job to hopefully try to find someone to work in that area. Some of the rural areas are somewhat tougher than more populated areas, but we have been very successful in finding companies across the United States to help in such areas. So yes, absolutely, you could still refer to the program.
Thank you, Kathy, and thanks for the question, Bernadette. And now, this is kind of how we've broken the program down. So, in terms of the guide program, if you're an individual, it's not like you could sign into guide.gov and sign up individually. You have to work with like a visiting angels, and we're working with Continuum, and that's how we're able to qualify individuals for this program. And through our partnership with Continuum, we've created like so in terms of this three-phase process. This is where like visiting angels, like myself, um, I have a coworker, Jill, who would walk you through this process. But it's a high touch process because this is a government program. There is paperwork required, but we've kind of gotten it down to a science. So with that being said, the first phase would be screening. And with that, we work with a company called Crosby Health. We have a software program where all we need is a patient's first name, last name, date of birth, Medicare beneficiary ID. It's an 11-digit number. Once we get that information, it takes about 30 seconds. And then it tells us if that individual has Medicare A and B, if it's even worth, really having a discussion to go to the next phases to qualify this this family's individual. Once we get the okay from phase one, we go to phase two. It's an interview. So let's say you clear phase one. What I would do is say, great, who is the caregiver? May I get his or her phone number, and then I would call that caregiver, and then I do the interview. With that interview, it takes about 5 minutes. We upload the paperwork, or sorry, we get the primary care provider's information, address, phone number, get a little more of the caregiver's information, whether the person has a power of attorney. So we do that interview, and then a medical consent form is emailed to the caregiver. That email, it would not come from Visiting Angels. It would come from Crosby Health. But once that consent form goes out, that caregiver acknowledges the consent form, and then it goes into phase three, where we would send one of our nurses out, and then they do the upload of medical diagnosis, medication, and they do the functional assessment, and they ask all the questions, to do all the documentation. Basically, the phase three, that all that information goes to CMS, and creates that documentation. And then once phase three is cleared, you've cleared all three phases, then we do an alignment, and work with CMS and verify that this family, or this individual does or does not qualify for this program, and then we would notify that individual. So high touch point, we walk families, individuals through every step of this process, so it's pretty seamless. And I don't know, Kathy, do you want to add and shed any insight to this as well?
Yeah, it can only so this whole process from start to finish, depending on when the assessment is completed, and we get all of it, and our care navigators look at all of the information that has been given to us. Um, it can take anywhere. It used to be from 10 to 21 days. We are now being told it's probably going to be taking closer to 10 days. So that's really exciting for us. And that's news to Will too. So we were just informed that this week, and we're trying to figure out how that's going to work moving forward. But we're very excited, so that it will be a faster process instead of people having to wait up to 21 days to find out whether they qualify or not. So,
Yeah, that's really exciting. So we've had a question come up. It's essentially about, the question is, uh, would would they would like Medicare bill insurance directly? Kind of basically, would the patient pay out of pocket, and be reimbursed, is one
got
part of
it.
the question. And the other,
So,
okay, yep,
good.
yeah, well,
Yeah,
let's
I
start
was
with that.
listening.
And
Well,
there's a
let's
two
start with
part. Let's
that.
start with that.
Yes. So, Medicare insurance is billed directly. There is no out of pocket cost. The only out of pocket cost is if you decide to join a telehealth uh, online appointment with a physician. Just like Medicare only covers maybe like 80% of a doctor's visit. And if you don't have a supplement to cover the other 20%, you would be responsible for that. That is the only payment, though, that you are responsible for if you choose to do that. Otherwise, the program is covered in full, the care navigation, the respite care, the 24/7 hotline just to talk to someone and run something by them is completely covered by Medicare. You would not see, you do get an explanation of benefits saying what services were provided, but you don't have to pay anything out of pocket.
Thank you,
Mm.
Kathy. And also, so the other question is regarding, it says ARC, and I assume that's the Montgomery County ARC program. That's a Montgomery County like specific respite program. So
Mhm.
with that, it's either, if let's say you're interested in Medicare Guide, if you were to choose this guide program, then you wouldn't be eligible for that Montgomery County ARC. So it's like you kind of have to balance, like, I guess, one or the other on that, like really nuanced level.
Right,
That
and
was
they're
that was the
asking also if they're paid out of pocket by the patient as well, if it's a different bill rate. Typically, we have to accept Medicare's billing rate to provide this program. There have been, to go back to the other question about rural areas, some agencies will apply a distance fee because it's not applied to the care side of it. So if it helps get their caregivers to provide consistency for the patients, they might have a distance fee that is added onto that. But typically, for all the care issues, it is covered by Medicare for up to that 2560/30 per year.
All right, and we just got a big thank you. So, and thank you, Zara.
Yeah,
That
absolutely.
those are really good questions. Um, and I guess I'll pause for one moment. I don't know if anyone wants to type in any more questions before we start to wrap things up. All right, I'm not seeing any more questions. So, let's say, we've gone through this presentation. You think you'd be a great candidate. Like, how do you start? Like, what would you do? You could either reach out directly to me. This is my contact information, and I could easily begin that phase one of the process that we just went over. Or you could reach out to Jill Greenlee, and she is our intake specialist. She can do the qualification as well. So it's literally, yeah, whether you want to pick up the phone, send an email, this is where it would begin. And okay, Bernadette, so does the process begin with content no matter the state or where you live in? So that's a good question. So, Bernadette, if you are in Maryland and you're basically in Montgomery County, DC, or like Anne Arundel County, call us. Yes, that's how you start with our visiting angels. If you're in another state, then I would actually reach out to Kathy.
Yeah, and I can type in my phone number here. Um, we also have a 1833. I'm having to look it up because I don't know it by heart. That's great. um, so that's our phone number. We also have a online guide, dementia. Oh, I can't see where I'm doing dementiaprogram.com, where someone just like Will, if you're in a different state, if you're in the areas that Will covers, go straight to him because he's the expert in this area.
Mhm.
But if you're outside, you can also go to this website and put in information about a person, and then we will assign it to the right uh, company in that state or other than what Visiting Angels is already providing.
Yeah, thank you, Kathy. So, yeah, if like exactly what Kathy was saying. So, if you are, yeah, in Montgomery County or like, the basically the DC area, um, contact myself or Jill, and then Kathy was kind enough to put her information in the chat. So, just to read it off, the number to reach her is 833-801-4336, and she put in it's the guidedementiaprogram.com is in the chat too, for anyone. And before we go, any questions still? We want this is your time, and the goal really today. This is a great program. It's federally funded. Because it's government, sometimes it could be confusing, but we're really here to cut the red tape. So, we kind of want to be your Cliff Notes. I'm dating myself, Cliff Notes, not ChatGPT, but Cliff Notes on the guide program. Just, please, any questions, please chime in real quickly before. Okay. All right.
Okay.
So thank you, Bernadette, for your comments. Let's see if we have any more. 'Cause, yeah, 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 we have any more. ' Okay. Well, thank you everybody for joining us. Hopefully this was informative. I want to highlight that this has been recorded. We can share this as well. Please feel free to share. Um, and if you're going back through your notes, want to listen to anything, there's now a recorded record. Um, and you know, just kind of summarizing everything, this is about, the family caregiver. Um, my engagement with that this group is that it can be very isolating and overwhelming, but the goal today was to connect you with the right resources so you know where to begin. And this program is, I've already seen the effects with two or three individuals that I've qualified. So it's really forward thinking because it's not just about the person with dementia. It recognizes it's really a family, and there's more people to this one issue than just the individual. So I really appreciate everyone's time. And Kathy, want to give you one moment too. I don't know if you want to add anything as well before we head out.
No, we just truly appreciate the partnership that we have with Visiting Angels. Phenomenal to work with. Great communication. Just they really go a step above for their client. So I'm so glad that they're part of this program, because this program, when we joined in 2024, it was so minute. We had, our little team in St. Louis where I'm stationed, and that was about it. And to see it nationwide and helping so many people, keep them out of hospitals, keep them out of nursing
Mhm.
homes, which is the function of this whole program, and giving the families and the clients the support they need to be successful. It's because of people like Visiting Angels, is that's why it's happening. So thank you so much.
Oh, thanks, Kathy. So, um, yep, I know everybody's busy. Want to give you back your time, but I really appreciate everyone that joined this. Hopefully, it was a good use of your time, and hopefully, you have a better understanding of this program and really knowing where to start to begin this journey. So, thank you, everybody.